Okay, we're here today with Dr. Wigoda. Hi, Dr. Wigoda.
Hello, how are you?
Good. Talking about the past, present, and future of plastic surgery. So, Dr. Wigoda, tell us about the last decade in plastic surgery and some significant events.
Okay, actually, interestingly, I started in practice about 10 years ago. And when I finished my training, compared to what we're doing today, there have been quite a few differences. At that point, we were just starting to learn ultrasonic liposuction. Before that, we were just doing suction-assisted liposuction. So ultrasound was a nice advance with liposuction, that it melts the fat. You can get more fat out. And there's some other advantages as well. In the recent couple of years, smart lipo was developed, which has received a lot of media attention. It really isn't a major advance technologically, at least from my standpoint, with ultrasound compared to ultrasound, but I think liposuction became even more popular just because it was advertised so effectively. When I just started in practice, Botox was being used for cosmetic purposes. It hadn't been approved yet for cosmetic purposes, but doctors were using it off-label. And a couple of years after I started in practice, Allergan, which is a company that sells Botox, got it approved, were able to market it, and so Botox basically took off. And when other companies saw how much Botox was selling and how popular it was becoming, other companies became interested in developing their own sort of Botox. And this past year, one other competitor came out called Dysport, and we're just basically now learning about it to see if it's the same, better, or worse. We really don't know yet. Also, when I started in practice, the main filler was collagen, which was a very nice filler, except it didn't last very long. So the market, again, is very large, and companies, all different sorts of companies, started developing fillers that would last longer, that were less expensive, whatever they could do to get a piece of the market. And today, collagen is actually not used very much. There are other fillers, like Restylane came out maybe 5 years ago, and then Juvederm, Radius. These are all improvements on collagen, and they each have their own advantages and disadvantages. So that's sort of what's happened over the past 10 years. The other thing that happened with breast surgery was that silicone implants were approved for general use, whereas before that, because of the controversy that happened in the 1990s, you had to become part of a study, and only certain people qualified for that study. So probably more than 90 or 95% of women were getting saline implants, whereas before the controversy, the majority were getting silicone implants. Now the trend is moving towards silicone again, because silicone is probably a little bit of a better product overall. It is a little bit more expensive, partly because of all the lawsuits and the controversies, but I would say, certainly in my practice, probably 70 or 80% of the women get silicone implants as opposed to saline. So there's really been changes, in all different aspects of plastic surgery, the surgical side and the non-surgical side. With the improvements in the non-surgical side, which is the Botox and the fillers, those have become a lot more popular. People are putting off facelifts or other surgeries because the fillers sort of give them enough of an improvement that they don't want to do the surgery. Which is not to say that we're not doing facelifts, because doing a facelift and having a filler are really not identical. They certainly don't replace one another, but along with the economy, with people having less money to spend, the fillers are a good alternative in the meantime if money is certainly an issue, as obviously the surgery is more expensive.
Okay, well, that was a good look at the past decade in plastic surgery, and we're going to catch up with you next time and talk about the next decade and what we can expect in plastic surgery to come.
Okay, sounds good.
Thanks, Dr. Wigoda.